Welcome, everyone. We are excited to be here today for the webinar, The Guide to ABEM Certification. We're joined by a great panel of presenters today, ABEM President, Dr. Diane Gorgas, and ABEM's Initial Certification Administrator, Sarah Mohre. They're going to go over today the steps to certification, the value of ABEM certification, and walk you through that today. I will want to let you know that the Q&A is live and open. We'll facilitate a live Q&A session at the end, so go ahead and feel free during the session today to put your questions in, and we'll get those covered at the end. Diane, can you start us off?
Yeah, thank you so much, AJ, and welcome everybody. Glad to have you with us today. We're pleased to be here to share some of the latest updates on ABEM's initial certification process. As AJ mentioned, I'm Diane Gorgas. I'm the current president and the chief of the Certifying Examination Working Group. Put your questions in the Q&A. We will cover them at the end. For those of you that gave us questions ahead of time, we thank you for those. I want to be sure we have enough time for questions at the end, so let's jump right in. Let's first go over ABEM's role in our specialty. We are the organization that certifies emergency physicians who meet the educational standards and can demonstrate that they are independent practitioners of emergency medicine. The ABEM Board of Directors are experts in emergency medicine. We are from literally across the country. We have a diverse set of skills and backgrounds, from community medicine to academics. And our mission at ABEM is to ensure the highest standards in emergency medicine. ABEM certification is sought and earned by emergency physicians on a voluntary basis, but as all of you know, attending this webinar, it is the gold standard in emergency medicine, and the vast majority of emergency physicians choose ABEM for their certification pathway. Our purpose is to improve the quality of emergency medical care, to establish and maintain the high standards of excellence in emergency medicine and all of its subspecialties, to enhance emergency medicine education and related subspecialties. And we are an evaluatory organization. We evaluate physicians and we promote professional development through initial, but also continuous certification in emergency medicine and its subs. We certify physicians who've demonstrated special knowledge and skills in emergency medicine. And we enhance the value of certification for ABEM diplomats so that we can all serve the public and medical professionals. ABEM holds the interests of both patients, patient families, and our diplomats in the highest standing, particularly with regard to provision of the safest, highest quality emergency care. ABEM addresses its commitment to patients by supporting the physicians who provide that care to the acutely ill and injured, and by working to transform the specialty of emergency medicine. You're going to hear me say it once and multiple times throughout this. Please visit the ABEM website to learn more about the board, our mission, the initiatives, and certification. So you really are the future of emergency medicine. And how does ABEM fit into your career? ABEM certification will be valuable in that it gives you added compensation, tens of thousands of dollars more if you're an ABEM diplomat, if you are ABEM certified, than if you are not, annually. It gives you recognition as a specialist. It does place public and patient trust in you. It gives you more practice opportunities, and certainly there is a sense of professional pride in being an ABEM diplomat. Your role in emergency medicine after you are certified by ABEM is the gold standard for emergency physicians. It indicates that you're dedicated to delivering high quality care and that you've demonstrated the skills and ongoing expertise needed to meet the highest professional credential in emergency medicine. It also really signals your commitment that you're going to stay up to date. As the long time ago football coach at Ohio State said, Woody Hayes said, when you're through learning, you're through. So we want to make sure that you stay up to date with the latest medical advances. At any given moment in the emergency department, life hangs in the balance. An emergency department may have physician assistants and nurses and nurse practitioners and others who play important roles, but like 80% of the public, we at ABEM believe that physicians should lead emergency care. And we really look forward to working with you to achieve your ABEM certification as you move forward in the next steps of your emergency medicine career. So what's important to you is to understand the purpose of initial certification, which is to really objectively and independently confirm that you all who have completed an emergency medicine residency can demonstrate core knowledge, skills, and abilities needed to practice emergency medicine independently and at the highest standard. As you've heard, the steps to certification are going to be changing in 26. The oral exam or the virtual oral exam, while it proved relevant, will be going away after 2025. And I'm here today to tell you some of the reasons why we're transitioning to the new certifying exam. But in 2026, the final step for certification will be the new certifying exam. So if you are a terminal year resident in emergency medicine, you have already received your application material where you apply for the initial certification process. You will then be given a seat for the qualifying or the written exam. Once you pass the qualifying exam, you will be seated for the certifying exam. And after you pass the certifying exam, you have become ABEM certified and you are a diplomat as long as you continue with continuing certification. One message that I want to really drive home, it is best not to delay certification. You should apply starting in April, the year that you're graduating. You should take the qualifying exam that fall and then the certifying exam the following year. Every once in a while, we hear from residents or recent graduates who are board eligible that they want another year to study. The statistics prove that that is not helpful. You should take the exam straight out of residency. Submitting the application and registering for the qualifying exam can all happen in one step. You get the application emailed to you. You complete the application, and then Sarah will be on later to talk about how you register for the qualifying exam, which is taken through Pearson VUE testing centers. And there are hundreds of Pearson VUE testing centers across the nation. Chances are there's one in the city where you're living or close to the city where you're living. We do get questions about what does board eligible mean? Your program director is going to let we at ABEM know when you meet the training criteria necessary to be board eligible for certification. Board eligibility begins after your graduation date once your program director verifies you completed training, but it expires 5 years later. This is another cautionary tale to please don't delay taking the exam thinking that you'll be better prepared in a year or that your life will slow down in a year. It expires 5 years later on December 31st of that final year. The certification application fee is $420 and the qualifying examination registration fee is $960. The qualifying exam, the registration will be open for that. It technically opened May 27th. I know that some of you may be having difficulties in registering to get an exam seat at this point. Sarah is going to address that. We have a 1-week administration window, and this year that week will be between November 3rd and November 12th. As I mentioned, it's at Pearson VUE testing centers. This is a 305 multiple choice question test. It is criterion referenced, which means that there is no set passing score. If everybody does well on the test, everybody will pass the test. We don't grade on a curve. We grade based on the criterion that have been set by practicing emergency physicians. The scores for the qualifying exam, ABEM is dedicated to get back to you within 90 days. Typically, we are a little shorter than the 90-day period. We can generally get these back between 30 and 60 days, but please allow us at least 90 days, just in case we need to go through a standard setting or there's any irregularities with the exam administration. Also keep in mind that your in-training exam score really does help predict how you are going to score on the qualifying exam. So if you are in the bottom 50th percentile, or if you have a chance of passing the qualifying exam that is given to you that is less than 80%, when you take the in-training exam, please take that seriously. That means that some intervention, something that you're doing, something that your program is doing, really needs to help you prepare to increase the likelihood of you passing the qualifying exam. Next slide. The pass rate for first-time test takers is currently 82%, and for all test takers, it's 80%. This is lower than we saw in 2023 and follows a multi-year trend. We have been actively engaged with stakeholder feedback during the Becoming Certified initiative. And the one absolutely consistent note that we heard was that the ABEM board of directors and that the certification process should maintain the highest standards, and that's really of paramount importance. ABEM is really committed to these standards by maintaining the current standard for the qualifying exam. The 2024 exam was not more difficult. That's what we do when we criterion references. We compare it to practicing emergency physicians out there. And we know that the exam's not getting more difficult. But because of the magnitude of this year's decline, ABEM verified that this exam was a real decline in performance and not a function of a more difficult exam. This QE exam performance results actually follow a 6-year trend, and we can postulate so many different reasons why we're seeing the qualifying exam scores declining over time. We are really committed to working with the emergency medicine community to identify any factors that we can that are associated with this decline. We're looking to answer these questions and provide support on next steps for all physicians in the certification process. So let's move to talking about the certifying exam now. The final step for certification is going to be the new certifying exam. Residents are no longer going to be taking the oral exam or the virtual oral exam. This exam is new, but the idea of building the exam and the components of the exam are not new. They are taken straight out of the practice of emergency medicine. This exam was actually created after a multi-year initiative where we engaged the entire emergency medicine community. We heard from you. We heard from multiple resident groups. We heard from hundreds of residents. We had input from over 4,300 voices in the form of surveys and focus groups and interviews and a summit. And what we heard as central messaging for this was that our assessment needed to be innovated. We needed to assess more than just clinical problem solving. We needed to assess procedural competency. We needed to assess ultrasound competency. We needed to assess communication and interpersonal skills and teamwork. And we needed an assessment that could really adapt to the future of medicine. If you're interested in the underpinnings behind why the exam changes, go to the ABEM website. There's more background on this initiative and the findings on the website. But the outcome is that we have a brand new exam, and it will assess additional competencies. Clearly, the practice of emergency medicine has changed since I was a resident 25 years ago. And certification has to change to meet those new demands. It's more important than ever that certification maintains those highest standards. It differentiates emergency medicine trained physicians from other physicians who may be working in the emergency department that don't have that ABEM certification. And equally importantly, it differentiates between board certified physicians and non-physician providers. So the certifying exam is a new in-person exam. It's going to be given at a testing center in Raleigh, North Carolina. You as a candidate will be examined for a half-day session. And during that half day, you'll be exposed to two different case types, clinical care cases and communication and procedural cases. We cannot assess the quality of care, decision-making, and communication on Zoom. This must be done in person, especially for the procedural, the ultrasound, and the direct standardized patient interactions. There will be clinical care cases that will seem familiar. We embraced and understood that there's a whole nother sector out there that we needed to evaluate. Next slide. The certifying exam case types that we're talking about under clinical care cases, these will all be 15-minute cases, and there are 4 cases per exam session. You're going to have 2 examiners in a room for these, and the content areas are split into clinical decision-making, which think the structured interview, but ramped up a little bit. So the structured interview is like you presenting a patient to a faculty member, and the faculty member saying, why did you present that bit of history? Or why did you choose to do a physical exam on that organ system? Or what's your differential diagnosis? Or what diagnostic studies are you thinking about? What treatments are you planning on instituting? Those are the clinical decision-making cases. The new type of clinical care case that you're going to be exposed to is the prioritization case. And the prioritization case comes in 2 flavors. One is when you come into a shift and there's a tracking board with between 4 and 8 new patients on that board. And your examiners will be asking you, which of those patients do you want to examine first? What critical information do you need to get to decide if any of those patients need acute interventions? And also, how do you handle interruptions that may occur? If a nurse hands you an EKG or there's a phone call in the middle of while you're prioritizing these patients, how do you task switch and be able to re-embed yourself within that prioritization case? The second type of prioritization case is triaging multiple patients arriving without warning, so like a mass casualty incident. Both of these we think will really ring true to what you do in the emergency department and how you approach a busy board that is hemorrhaging with new patients, and you have to decide who to see first. The clinical care cases will make up half of your session. The second half of your session will be a pivot to the communication and procedural cases. You're going to get 6 of these cases per exam session. These are 10-minute cases with a 5-minute break between each case. You're going to all have a procedure case and an ultrasound case in the new exam. All of you are going to have 2 patient-centered communication cases and 1 reassessment case. And then half of you, randomized, will have a difficult conversation case. And this is a breaking bad news case, something that unfortunately we need to do far too often in emergency medicine. The other half of you will have a managing conflict case. The conflict that we need that we see and that we need to manage on a daily basis is between us and other professionals, us and the patient. If we want to institute a plan that the patient doesn't agree with, how do you work through that conflict? These are all of these are patient-centered, but these are the case types that you're going to see in the communication and procedural case half of your exam. ABEM takes bias and fairness in testing very seriously. Next slide. We are I will say, I think the only board at the American Board of Medical Specialties, if not only one of a handful of boards that are accredited by the National Commission for Certifying Agencies. And this really says that we have the highest standards for fairness, reliability, and validity. In the new exam, this means that we're going to have experienced professional patient actors, which will help increase our reliability. Our cases undergo review for bias. We have multimodal scoring of our cases to make sure that bias is not introduced in the scoring process. The examiners are evaluated for administration and scoring accuracy. The examiners, the case developers, the staff, the board of directors are all trained in recognizing and mitigating implicit bias. And the scoring and equating processes that ABEM has used in perpetuity can adjust for variance in scoring stringency. Next slide. ABEM is looking at flexible scheduling options for exam candidates. Rather than having just three blocks that you can schedule for your virtual oral exam, you now are going to have 9 exam sessions that you can choose from, or I would put more accurately, that you can tell us if you have conflicts with. We can't tell you that we can schedule you for one of these 45 days during the year, but we can certainly tell you that if you're getting married, or if you're on family leave, or if you've got other commitments that you have to see to, we can help you work around your schedule to get you more flexibility. So you're going to have some input and the ability to request exam administrations and to share conflicts for those that don't work. You're going to be assigned to a half-day session during one of the multiple exam administration windows throughout the year. We're not going to be able to accommodate every request, but with more exam sessions offered throughout the year, there will be an increase in the ability to accommodate differing schedules. Next slide. Please check out the new certifying exam resources that are available. The new resources that have just come online within the last couple months, there are certifying exam sample case debrief videos. We have received lots of feedback about, can we see what the score sheets are going to look like? Well, no, but we can definitely give you an idea of what we're looking for. And that's what the sample case debrief videos do. That is also what the PDF attached to every case does. It has a single line in it that says that a successful candidate will be able to A, B, C, D, E. Those are the things that we're looking for to be able to gauge that you have successfully completed a case. Some of the other new resources that are available, there is now a procedures list on the website, as well as an ultrasound list. I'm going to double down on ultrasound here and say that there's a lot of angst about how we are going to be examining ultrasounds in the new exam. I want to let you know that you will have you will be able to select the probe based on the exams that you want to do. There will be a patient. You will be doing a real-life ultrasound exam on a standardized patient. You do not need to know the equipment knobology. If you want to increase the gain or increase the depth or switch modes, there is an examiner in the room with you. And all that you need to do is tell that examiner to adjust the machine appropriately for you. There are hundreds of different ultrasound machines out there. We're not expecting you to know the ones that we're going to be using, nor to have those in your residency training program. So we're going to be as helpful as we can in helping you get the images that you want. You're going to tell us when those images are satisfactory to you. We're going to have you identify some structures within those images. And then you're going to be seeing a video of an ultrasound examination that somebody else completed, and the examiner will be asking you questions about that video. So check out those new resources that are available. Next slide. Speaking of checking out resources on the website, one sample case video is available for all 8 case types. And as I mentioned before, these include PDFs of the case materials that give you a lot of granular information. Each case type is there to assess a different competency important to the specialty. And these sample cases were created to demonstrate the flow, the mechanics of a case, not necessarily to explicitly anchor to the case content. So sample cases represent a typical case format using an average passing test taker. And the videos, as I mentioned, all have accompanying case materials available. The scoring information that is supplied with these sample cases is also helpful to consider when reviewing the videos. Thank you. If I haven't mentioned it already, please check out the ABEM website. All of the resources, the sample case videos, the debrief videos, the scoring guidelines, the case references, the case summaries, the procedure list, the ultrasound list. This is the QR code that can really save you time and effort. But if you miss this slide and checking out this QR code, our website is so easy to get to, www.abem.org. So if you are in a residency program that hasn't had a speaker to specifically talk to your residency about the certifying exam, please ask your program directors to arrange that for you. We have been able to reach over 120 residency programs to share the latest information on the certifying exam. That's 40% of all emergency residency programs. If you haven't received a specific lecture or a visiting lecture on the certifying exam, encourage your program director to sign up and have an ABEM speaker share updates with you. So what's next? If you are graduating this year or after, you will get that email that says your application period is open. You will apply. You will be offered choices to register for the qualifying exam. Once you have passed the qualifying exam, we will reach back out to you and tell you, congratulations, you've passed. Now it's time to schedule for the new certifying exam. We are in the process of developing orientation videos that show us in real life what it looks like. What's the hotel that you're going to be staying at? How do you get from the hotel to the testing center? What does the testing center look like? We have had multiple organizations come to the testing center, including the Council of Residency Directors. ASEP has been to the testing center. AAEM has been through the testing center, and they've walked through the center. But we know that you as a candidate want to see exactly what that looks like. So we're going to give you a video walkthrough. And we are also pushing periodic updates out there for you to look at as well. Next. It's important for us to tell you that we really do have a shared interest. We want you to pass. Our goal is not to see people fail. Our goal and our responsibility is to the public, is to the patients that we care for, and is to keeping you as a residency graduate and a future diplomat of ABEM practicing at the highest standards. You want your ABEM certification to have value, and we want to ensure that the ABEM certification has value and brings value to you, but also to the hospital systems, the insurers, and the public that we serve. Next slide. And in doing so, we are here to support you. We're here to support you through the website. We're here to support you if you call us. There will be one phone tree that you have to go through. But after you get through that first phone tree that says which department do you want to talk to, there will be a person that answers the phone at ABEM. And we are here to support you not only now, but we're here to support you throughout the rest of your career. Next slide. And one way that we're here to support you is that we understand that you are feeling at your financially lowest point, probably in your careers. You have student loan debt. You have had a reduced residency salary during your training period. You have potential relocation expenses, and these can quickly accumulate as you begin your career. The ABEM Board of Directors has taken this into account. And when it comes to standing up a new certifying exam, we are committed to you that we will not raise the cost of that exam, at least for the next 3 years. It is costing us a lot more to develop the exam, but it is not going to cost you more to register for and to complete the exam. Now, we do understand that those of you that don't live in Raleigh, North Carolina, will have to travel to take this exam. We understand and we have empathy for the financial obligations that you have. ABEM has been in contact with Merrill Lynch Wealth Management to explore and share various financial options and resources available to support you. If you need financial guidance or if you have questions, Dan Fisher, the Assistant Vice President at Merrill Lynch, has served as a personal financial concierge for our candidates, and he can provide you with guidance for the various options available for you to really help make this exam affordable. And lastly, ABEM supports you. Once you become certified, you have ABEM support throughout your career. We're working to help promote to the public what your certification means and the value you bring as to the emergency department as a board certified emergency physician. You can download letters of support to forego merit badge requirements like PALS and ACLS. We have resources to promote your certification on the website. We help you stay current. We help you stay certified. There are volunteer opportunities. If you don't like the way that the exam was structured for you, I would encourage you, come volunteer for ABEM. Let us hear your voices. We do listen to people's feedback, and we have largely adjusted a lot of the information that you have access to and are gaining for part of the certifying exam because of your feedback. So contact us, abem@abem.org is our email. Is that right, Sarah? abem@abem.org is our email. There it is. Or find our resources at www.abem.org. I'm going to turn it over to Sarah now to talk about some introduction to the website and some of the technical aspects in getting you certified. Thank you, Sarah. Go ahead.
Yeah, thanks, Diane. Like Diane said, my name is Sarah. I'm just going to kind of walk you through some parts of our website and how to apply and do the registration. So next slide, please. So this is our website. So if you go to that www.abem.org, you're going to land here. These are where a lot of those really helpful resources are going to be, especially Get Certified here, that's circled for you. That's going to have a lot of the CE information Diane just went over, and as well as application, qualifying, oral exam dates, deadlines, and such. And next slide. Up here in the upper right-hand corner, this is going to be your My ABEM sign-in. So this is how you are going to get to your physician's portal. Once you click on that, this is going to be your landing page. This is our new physician portal. It is live now. You all should have received an activation email, and that just instructs you on how to kind of reset your password and get logged into the new system. If you have not received that email yet, please reach out to us. We'll be happy to resend that to you. Once you get logged into the portal, you are going to land here. This is what we are going to be calling your dashboard. This kind of shows where you're at, things that you need to do. And if you go over on the left side, you'll see activities. You can click it there, or you can click complete activities on your dashboard. Both places will take you to your activities page and things that are upcoming or things that you have outstanding that you need to do. Right now, you all are in the application process. So this is going to be what yours looks like. Similarly, there might have some attestations that you need to complete prior to, but you'll click on this apply button. Once you click on apply, here is the online application. This first step is really important. you'll hit edit and you'll want to fill in any missing information or update anything that's incorrect. This information, including your address, phone number, that stuff is how we send your authorizations to Pearson VUE. So if things are missing from this page, that can kind of hold up that authorization being sent. But once you've completed that, you'll go to step 2. And this is just a medical license attestation. You'll answer those questions. And then you'll go to step 3, which is the certification agreement. You read through that, agree to that, and then you'll go to the final step, which is adding this to your cart. Once you click add to cart, I wanted to point this out. So something that we did a little bit different this year and moving forward is you'll see that the qualifying exam fee is also in your cart. This used to be 2-step, now it's just 1. So you'll complete this fee and that has registered you for the qualifying exam as well. So it's kind of a one-stop shop with that. Once you've completed your payment, you'll go back to your activities page. You'll see that now you have an assessment and you can schedule an assessment here. Now, like Diane has noted, we do want to acknowledge that we are having some issues with this step right now. Some are able to get through, some are having a little hiccup here. We are working on resolving that. I know a lot of you have reached out already. And if you have, as soon as this has been resolved, we will reach out to you and let you know that that is working for you again. So we appreciate your patience as we do work through that. I know it can be a little frustrating. But then after you schedule your assessment, you'll get that email from Pearson VUE just kind of confirming that information. And you'll be all set with that. And I think kind of the last thing is we're going to go through some questions that you all have brought up during the webinar.
Thank you, Sarah. Thanks for going over that with us. And thank you, Diane, for sharing your insights as well. We have had some questions come into the Q&A, so let's dive right into those. We've had some questions, Sarah. You talked about the system, the new online system and the applications and scheduling. Is there any disadvantage for those who haven't been able to schedule yet?
It's a good question. No, so it's going to feel like you're disadvantaged by not being able to schedule that first seat. We are very aware of these issues. Like I said, we will make sure that you get a seat that works for you. If you have any issues, please reach out to us. And we're happy to help get you scheduled into a seat that works for you.
Thanks. And just a clarifying question, that there was a question that came in about, is there a direct link to the application or what's the link to apply?
Yeah, so once you get your activation email, that'll take you to our portal. And once you log into the portal, that is going to be where you will actually register and apply. And you can get to the portal also at www.abem.org. Up in the upper right-hand corner is how you'll get into our portal.
Great, thank you. Diane, we had some questions about the pass rates and why ABEM's pass rates have gone down recently.
That's a good question. And truly, the answer is going to be a complex answer. We are going to be careful in looking at associations and separating those from causations. Some of the facts that we know are that COVID impacted residents and residency training, but there are other impacts as well, including boarding in the emergency department and the number of undifferentiated cases an average emergency physician is now seeing during their entire training period. We also know that current residents are using different resources to study emergency medicine than sometimes the more traditional resources, where typically multiple choice questions are mining as citations for those. I think that there's a lot of different potential associations that we're looking at. It is nice to know that emergency medicine does not sit alone in this phenomena, that a number of different boards are noticing that their multiple choice question, qualifying exam, board certification, pass rates are going down. We are going to continue to look at this and specifically work with the Council of Residency Directors and any other educational fora that are out there for emergency medicine to see if we can find some interventions that would help address this issue. It's a great question, though. Complex, but a good question.
Thank you. Sarah, there's a question that came in about the qualifying exam that a physician's talking about that they might be graduating off cycle in August. Will they be able to take this upcoming qualifying exam, or do they have to take it in the next cycle?
Yeah, so as long as you graduate on or before October 31st of 2025, you will be eligible to take the 2025 qualifying exam.
Great, thank you. Diane, we have lots of questions about the certifying exam, so let's dive into those. I think this was covered in your presentation today, but it's an important one to clarify. For those who are senior residents graduating in 2025, will they be taking that traditional oral exam or the new certifying exam?
If you are graduating in 2025, you will be taking the new certifying exam. We only have 2 virtual oral exams, or the old exam, left to give, and both of those you would have needed to complete the qualifying exam, the written exam, in 2024 to be able to sit for those. So everybody that's currently a resident, even playing field, starting in 2026, you're all going to be taking the certifying exam.
Great, thank you. There was a question about the registration process for the certifying exam. When does that take place?
So we're gonna answer this one jointly. The first thing that you need to do is pass the qualifying exam. Once you've passed the qualifying exam, you'll get a congratulatory letter that outlines those next steps for you. Sarah, do you want to talk about what those next steps look like once they've passed them?
Yeah, so once you pass the qualifying exam early in 2026, we will be sending out a survey that you'll kind of get to pick like because we will have 9 administrations, I think is how many we have. So you'll kind of get to give us an idea of what works best for you. You won't maybe get to pick the exact date and time, but you'll give us an idea of what weeks work best for you. And then we will work on scheduling people into the sessions that work best for their schedule. So it's still randomized a bit, but we're trying to alleviate some of the stresses by allowing you to pick weeks that might work best for you, kind of rank them like week 1, 2, 3, and we'll try our best to get everybody what works best.
Great, thank you. Diane, there's some questions about preparing for the procedure style questions, and is this certifying exam different than medical school OSCE cases?
So yes, it's different than medical school OSCE cases in a number of different ways. But I think that those are kind of 2 separate questions, so I'm going to tease them apart into 2 separate answers. For the procedures, there is a procedure list out there. There will be an examiner in the procedure testing station when you go in. You will receive a case vignette that gives you some patient demographics, maybe a chief complaint, and then your task is and then the procedure will be listed. When you go in, the examiner will ask you questions like, what are the indications for this procedure in this case? What are the contraindications for the procedure? You will perform the procedure, and I encourage you to talk outside of your head, just not to use your internal voice, to tell the examiner what you're doing during the procedure. And then there'll be some discussion between you and the examiner afterwards about what are your thoughts if a complication occurred? Why did you choose that piece of equipment? What advantage might that have given you? So think about this as it's really an interaction like you and an attentive faculty member would have at the bedside if you're doing a procedure, for a little bit of a debrief as well. Now, the other question is, with the communication cases, is this different than an OSCE case? Well, it's different in an OSCE case in a few different ways. First of all, an OSCE case typically looks at just the history and physical. The patient-centered communication cases, the reassessment case, they will have you starting at some point in the case, but working towards the end point of either a decision or a disposition or a treatment plan. So they are more all-encompassing than what you've seen in medical school with the OSCE cases. The other second point that I think is going to be key is you're going to be getting a history from many of the standardized patients in the communication cases, but you will be describing the physical exam you want to do, and then physical findings will be given to you on a sheet of paper. It is really difficult for us to get our standardized patients to wheeze for you, or it is really difficult to get our standardized patients to have a pneumothorax for you. So you will be handed a sheet with physical exam findings on it, and you won't actually be doing a physical exam. Wrapping up the case, though, is a big component of it. So I would encourage you, just as you do in the clinical setting, when you have faculty there and the faculty are watching you talk to a patient and give discharge instructions or explaining to somebody that they need to be admitted, get feedback on how you're doing that. Thanks, AJ.
Absolutely, thank you. There's a question about the cases that involve hard discussions with patients, so the communications aspect, and scoring the test takers on empathy. How is ABEM measuring that in a non-subjective way?
Thanks for that question. It's a great one. So there are best practices out there on how bad news is delivered. They're on the website. I would encourage you to explore those. Empathy is one of those things, though, where it can be broken into a number of smaller components. Are you allowing the patient to speak? Are you not interrupting? Are you using the appropriate body language to demonstrate that you're empathetic? Are you paying attention to what the patient is saying? All of those things where they seem very subjective actually have many objective markers to them. Sometimes it's holistically viewed, and there's nothing wrong with, empathy is really from the patient's point of view. There is nothing wrong with the patient saying, I felt that the doctor listened to me. And there is some value in that subjective assessment. But at the same time, the sense or the feel that that patient is being listened to and that their doctor cares about them, there are some very specific markers that we can use to judge that.
Great, thank you. We have a follow-up on your comment about not providing scoring rubrics. Can you provide some additional reasoning on why sample scoring rubrics can't be provided?
Well, just as for the former virtual oral exam, none of the actual scoring rubrics were provided for that. Again, I think that there is tons of information on the website that says, a successful candidate will be able to, and then a listing of what we are looking for on those. The scoring rubrics itself and the way that we are getting to a numerical score, we want this to be a valid examination, and that would be like giving the answer key to many of these. So empathy is a great example of that. We want you to be empathetic. We want you to really care about what the patient is saying. We don't want you to memorize a checklist of tricks or tools that make it appear that you're empathetic to the patient. We just want you to demonstrate empathy.
Will our test takers know when they're on site at the exam? The question is, will they know when they're walking into the communication type cases versus the clinical cases?
Well, for sure, that differentiation will be clear. It's going to be very clear when you walk into an ultrasound case or a procedure case. Now that the different types of communication cases, patient-centered communication, breaking bad news, conflict management, and reassessment, likely there will be a standardized patient for some, if not all of those, but we are not differentiating which of those 4 types of cases it may be for them. We're just asking them, truly feel like this is you working in the emergency department. You don't have to know the outcome or specifically what we're assessing. Just take good care of patients. Just manage conflicts with staff or other professionals or patients like you would do in the emergency department. Just don't put your hands on your hips and say, I'm the doctor, and stomp your foot down, and that's the way that you manage conflict. That each of these cases, it will likely become clear as you're embedded in the case what the case type is, but just go in and practice the way that you practice good medicine. And I think that's going to be the best shield that you have against trying to reverse engineer what we're testing.
Thank you, Diane. What is the passing score for the new certifying exam?
There is no passing score for the new certifying exam, and this is where it comes to criterion referencing. I mentioned that fancy word earlier in the presentation, but we will be setting the standard for this certifying exam based on current practicing emergency physicians and their definition of a competent, independently practicing emergency physician. So let me give you an example. The ultrasound station. We are not setting the standard in the ultrasound station against somebody who has completed a fellowship in ultrasound and been practicing and instructing in ultrasound for 20 years. We are setting the standard in ultrasound versus an average practicing emergency physician's capacity and capabilities, knowledge and skills for completing an ultrasound to help in either diagnosis or treatment of a patient. So you are not being set to a standard that is unreasonable that's out there. You are being set to a standard that is an average practicing emergency physician. So because of that, I can't give you a passing score. What we know is that if all of you are prepared and you are prepared to the standard of what's currently out there in practice in emergency medicine, all of you will pass.
We had a question come in, or a few questions come in about materials, and I know you shared in your presentation all the material resources we have on the website. The question really has been, are more materials going to be coming to help study and prepare for the exam?
If there are specific materials that you think are essential to your success and some of your success is just your level of anxiety or angst about the exam, please contact us and let us know. We are willing to consider these. A number of the materials that we have provided already came from either program director or resident feedback. We are willing to take into consideration if there's key portions of material that you need. I will say, this is a contract that I have with you. I will consider any request that that comes our way for additional materials, but your part of the contract is please look at the website. Please look at what's already out there because there is a wealth of material already.
There's a question about, this is essentially the first class taking this new exam, and is there any consideration ABEM is taking into, being the first residency programs that are going into this kind of blind? What's ABEM doing to consider this and prepare residents?
Well, I think that the answer, which AJ, you've already alluded to it, and there was another question to it, is the criterion referencing. So the current practicing emergency physicians did not prepare for this exam. They weren't examined by this exam. And they will be telling us, yes, this is something that's reasonable. I would have known this at the end of my training, or I wouldn't have known this at the end of my training. I would have had no idea how to do that ultrasound exam. I would have had no idea how to list 17 potential complications from a procedure. I would have had no idea how to prioritize those two particular patients in a mass casualty incident that seem to both need interventions at once. So we are going to be using them to give us an idea, not our lofty ideas, not specialists, not subspecialists in disaster medicine lofty ideas of what is the definition of competency. We are going to be using practicing emergency physicians to give us that idea. So in the years to come, we anticipate that this will start to, the things that we're particularly testing on the new certifying exam will start to affect the way that residents are trained. We kind of expect that once physicians that have had this addressed in their residency training get out there and start practicing, that we may see competency in these different areas actually increase. So keeping that in mind, I anticipate that the scores of what we're looking for are going to continue to go up year by year. But as always, keep in mind that this is criterion referenced. You're not being compared to somebody who has been trained for this and really spent their entire residency focused on preparing for the certifying exam. You're being compared to practicing emergency physicians who have had no specific training in these areas.
Thank you, Diane. We have one last question. It's actually back to the qualifying exam, and it's about the Pearson VUE testing centers. Someone's asking if more seats will be opening up for the November exam, and maybe that they looked and there's no seats in their state or adjacent states.
Yeah, they will open up more periodically. However, if you've been looking pretty consistently, please send us an email, and we can also look into that on our end.
Awesome. Dr. Gorgas, any final thoughts today?
No, I want to really reemphasize that ABEM supports you. If we're finding that that somehow there are not enough seats available for testing, if you're running into difficulties, please, I'm going to reemphasize what Sarah said, let us know. Everything that we do for our assessment and testing needs to be fair, it needs to be accessible, it needs to be equitable. If we need to increase the testing span that we have for the qualifying exam, we'll do that. But please let us know. We don't know of the difficulties that you're having unless you tell us. So we are available to answer any questions that you have and keep in touch. And thanks for being here. Thanks for your time.
Yes, thank you for everyone who connected and listened in today, and thank you to our wonderful speakers. As Dr. Gorgas shared, you can reach out to ABEM at training@abem.org for any specific questions, as well as abem@abem.org if you have any questions. We're here to support you, and thank you all for joining today.